Hi guys, my name is Barbara Gilbrock, and today I'm going to talk a little bit about the career that I'm pursuing, which is a physician's assistant. I've always known that I had an interest in and a talent for the sciences, as well as a passion for helping people, and this career path has proven to be a great way to combine those two together. I'm really excited about it. So what does a physician's assistant do? Well, first of all, they're commonly referred to as a PA. That's what you'll normally hear them referred to as. And a typical day for a PA involves them practicing medicine on a team of healthcare professionals where they'll examine, diagnose, and treat patients. They're also responsible for ordering the tests and the diagnostic procedures such as CT scans, MRIs, and anything that they feel will help them better be able to diagnose their patient. They provide the treatment, so they'll prescribe the medication that they feel will help the syndrome or disease or whatever's going on with the patient. And they'll also provide education to the family members or friends, whoever is with the patient, so that they will better be able to assist the patient that is going to be discharged, because they won't be in the hospital or under direct care forever, and they need that support system at home. Once the patient has been discharged, the PA is also responsible for following up with the patient, assessing the recovery, and if the recovery that they were hoping for didn't end up happening, they'll explore new treatment options with that patient. About the profession, the work setting is really flexible for a PA. You can find them in a lot of places. The hospital is where most people think of first, but there's also outpatient care centers and specialty services such as eye doctors, physical therapy centers, rehabilitation centers, nursing homes, lots of places like that. There's also education services, which is, again, like a rehabilitation center, things where patients are going to need services, but not necessarily in a hospital setting. It might be an instance where they've been dealing with the condition for a long time. It's not something new that they need a new diagnosis. They just need frequent follow-ups to make sure that they're able to keep things under control and assess pain management options. Some more about the profession. So interactions that the PA is going to have throughout the day at work, regardless of where they're working, is of course with the patient's family, but also other healthcare professionals that include past medical providers of the patient. So if you get a new patient as a PA, you're having to communicate with whoever they've had in their whole life, pretty much, to understand the diagnosis they've had in the past, how that might contribute to what's going on now, and then also whenever, like I said before, you're ordering these diagnostic tests, well, you're not the one performing those. That's someone else. That's another profession that you're having to communicate with. And that communication is so important to ensure the safety of your patient and the overall outcome. That communication goes between you and people under you as well as people above you. So a PA works directly under the supervision of a physician, hence physician's assistant. And the physician doesn't necessarily direct the PA about everything they do. By direct supervision, it just means that that's who the PA is answering to. So the physician may give them certain orders to do things, but the physician isn't always going to be there. There may be days that the PA is at work without the physician, but if they have questions or if they need to follow up about a previous diagnosis, the physician is who they're going to be answering to, as well as, being sent to the principal's office type thing. They answer to the physician. So if they're in trouble, it's with the physician. Some requirements of the profession. So education, it's required a master's degree, which is a successful completion of a 2-year physician assistant school program after you've completed your bachelor's at a 4-year college or university. After that, you have to pass a physician assistant national certifying examination, which is called the PANCE. But in order to get into the 2-year physician assistant program, there are some requirements for that as well. So general requirements for most schools, although they do vary, is about a 3.5 GPA on average, of course, and that's in the U.S. In Florida, it's actually a little bit higher, and there are quite a bit of PA schools in Florida. They are looking around 3.8 is what they averaged in 2017. And there's also an entrance exam for PA school. It's called the GRE, and it covers a very large variety of topics. So studying for that exam is something that people will seriously take off an entire year just to study for this exam because of how important it is. And that score really does matter in getting into the physician assistant program that you want. In addition to that, there's a personal statement, which is very important, and it's basically an opportunity for you to advertise yourself or explain any discrepancies that may be in your academic record. If you had to withdraw from a semester, that's your chance to explain why. It's also your chance to explain why you're passionate about the program, why you want to do it, why you feel that you're going to do well at that specific school. It's really just a chance for you to advertise yourself. It's very important. The PA school that you go to, they're all different. There's general guidelines that they all follow, but they're all going to be a little bit specific and all have their own vision and morals, and it's really important to be well suited to that in order to do well in that program. So beyond getting the degree, getting the job, once you are a licensed physician, after you've passed the PANCE and everything, you've been hired, got your dream job, all that, you actually still have to continue your education, so it never stops. There's a recertification exam that's required for you to take every 10 years. If 10 years goes by and you have not successfully completed that exam, you can no longer practice. It would be illegal for you to be practicing PA without that. You're basically unlicensed at that point. And you also must complete 100 hours of continuing education every 2 years, and that is absolutely mandatory. You can be fired from your job if you do not complete that. So that's extremely, extremely, extremely important. So for me personally, like I said, I'm really passionate about this. I'm so excited about this career, and I was fortunate enough to know pretty early on what I wanted to do. So my plan for the next 5 years, again, my plan, totally hypothetical and things could change, but spring of 2019 is when I'm expected to graduate from the University of South Florida, and I'll be graduating with a Bachelor's of Science in Health Sciences. After that, I plan to go straight into PA school the following year, so right as I graduate, I'll be applying and already working on my personal statement, getting my GRE, studying started on, because again, people take off a whole year for that. So I will spend 6 to 8 months is the plan right now, studying for that exam, taking that, hopefully doing well on it the first time. If not, not afraid to take it again to ensure that I've got a good score for my application. And then I'll be applying, and hopefully 2020 is when I'll be starting if I do get in my first time. If not, then this timeline would obviously change. It would be 2021 or a year after that or something, but hopefully I get in 2020. So PA school is 2 years. On average, the programs typically last 24 months, but there are some that last 23 and some that last 27. It just depends on the program. And then 2022, when I graduate, I will hopefully pass the PANCE right away and begin working in the field. I'm not super stuck in Tampa. I don't know where I will end up or where my job will take me, but that's also really exciting to me, and I'm looking forward to the future in this career. And here are some references where I got my information. A lot of this stuff I hadn't really considered, so these references were a great help to me. And thank you so much for listening. I hope you learned something new.